Welcome back to Talk of the Town on 99.7, 1450 WHTC and WHTC.com.
Welcome back to Talk of the Town for this Monday, August the 9th. I'm Gary Stevens. It's the second Monday of the month, which means in this time slot, we are very pleased to have on the other side of our Zoom connection, third-term State House Representative Mary Whiteford from R-Casco Township, the South Haven area. She represents Allegan County, most of Allegan County in the State House. Mary, good morning and welcome back to WHTC.
Good morning, Gary. Good morning, everybody. Glad
you are with us. We have a question for our representative. She'll be happy to answer it at 616-395-1450, 616-395-1450. Mary, before we get to discuss some of the things that have been going on in Lansing, some of them you're directly involved with, as someone who's involved in healthcare and has been involved throughout most of your adult life, how do you take, and you heard from CBS some of the stories about the vaccines, people not getting them. How do you take information such as this? Because it seems as if people are making their decisions, maybe not knowing which way to turn because they're told one thing, they're told another. There's some sentiment about peer pressure and stuff like that. How do you sort of work with this situation?
I know it is really confusing. I come from a background where I worked at a children's hospital. I saw every one of the illnesses that children are vaccinated against. So I personally believe that vaccinations are proven. They do a good thing. Even my son, my youngest, got the chickenpox vaccine and he caught the chickenpox. He had like 3 little spots. So it was much less of an illness than his brother and sister had. So me personally, and from my background, I decided to get the vaccine as soon as possible against COVID. And it worked. I was able to take care of family members and I didn't get sick at all. But when it comes down to it, everybody has their own personal decisions to make. And I would recommend, talk to your doctor, talk to your nurse, get away from looking things up on the internet and just get as many facts as you can. And then you just have to choose the right thing to do for yourself. It's tough. It's like, how do you take care of a rash or a broken arm? There's different ways to do it. My mom grew up Christian Science, which I definitely don't agree with, but that was her mother's decision. So
the point I was going to make is that you just get a sense right now people aren't trusting authority more than anything else on this.
I think that's human nature. There's a lot of people who question everything, and then there's some people who don't. And you just have to do what's best for yourself and your family. But like everything, it's complicated. So do your homework, talk to your healthcare providers, and then make your own decision. We all have a God-given right for self-determination. We get to choose our careers. We don't live in a place where they tell you have to do certain things. And I think it's very important for us to uphold our God-given rights. And those have followed through into the Constitution. So I personally think it's a constitutional right as well.
616-395-1450. I have a question for State Representative Mary Whiteford. Peg McNichol has a question for you, Mary, from our newsroom. Go ahead, Peg.
It's actually a little bit of a two-parter. I wanted Gary to follow up on the Christian Science thing. So not everybody understands their approach to doctors and medical treatment. Could you just sum that up in a sentence or two? And then I have a second question that's slightly related.
Yeah, so I actually have an aunt who still is Christian Science, so they pray over things. When things have gotten really, really bad, like when her daughter broke her leg, she went to the doctor. So there's the purest sense of any religion, any faith, and there's the opposite. So I always grew up, my mom took me to the doctor because she found that it wasn't the right thing for her and our family. So that's basically the Christian Science viewpoint.
And I remember lawsuits over kids who were quite ill and the parents were praying over the child. And, there were people who wanted that child to get medical treatment that could be life-saving. So that's why I wanted to just clarify that. And then the other part is, I'm reading about this Delta variant and how hard it's hitting little children. There was that little baby who was airlifted out of Houston because they had no more ICU beds. And I didn't know till this weekend, responding to people on our social media, how many children, 369 kids under the age of 14 have now died from COVID. And this Delta variant is what I'm understanding is far more aggressive. What are your thoughts about kids going back to school? School districts seem to have a variety pack of approach, especially, K-12. Some aren't going to require, masks and some are. And what are your thoughts on this?
That's a really good point that you bring up. I saw kids seriously sick from chickenpox. There's always going to be an exception. I saw my grandkids with snotty COVID noses. There's such a widespread response, but the number one thing that we've noticed is the people who get the sickest, the people who die, are the older and elderly. And I think it's really important that we focus on that population. The entire shutdown was based on hospital capacity, which is really important. I think it is so important, especially with what we're seeing with children and their mental health crisis that they're in, exponential problems with that. We have got to get these kids back into school. They've got to see each other's faces. If you're sick, every single school has a desk set up with a thermometer and they're checking, are you sick? Go home. They never used to do that before. If a kid had a snotty nose, I remember I was at a school right before COVID shut everything down. There were kids with snotty noses. I think we can't go overboard. We have to remember fundamentally, these are children. They have to get back in school. I think it's heart-wrenching. Over 50,000 children were lost. Nobody kept track of them last year. The number of children who are being abused and neglected that we're not able to catch with our mandatory reporters. I think we've got to get these kids back to school. So if that was my decision to be made, that's what I would do. And I tell you, parents, if your kids are sick, keep them at home. I think there's been a huge emphasis on childcare and that there's actually more funding going to help people take care of their kids when they're not at school or when they're working. I think we have to keep going that direction.
But it does seem as if the Delta variant is specifically because it's so much more aggressive. What I'm reading in these statistics and these reports is that it is affecting younger children in a way that the initial few rounds of COVID kind of more attacked the older people our age and above. And it looks like this Delta variant is really hurting young kids more. You're a nurse. Are you seeing that also, or are you?
So I'm not a practicing nurse, but I tell you, every single virus out there mutates. I think we have to stop making everybody afraid and be vigilant. And that would be the only thing I could say to that. There's always going to be anecdotal information out there. We hear it left and right. So be vigilant, everybody.
616-395-1450. Let's get to the phones. Good morning. You're on the line with State Representative Mary Whiteford.
Yes. On that topic that you're discussing about the Delta variant, Ms. Whiteford, how do you feel about the fact that our government is allowing and letting illegal immigrants to come into different states and they know that they have COVID? Now, how in the world are we supposed to stop it when this administration is allowing this to happen? Thank you so much and have a great day.
Thank you very much for the call, Mary. That's a federal question, but the state,
Right.
It's going to come to the state thing because, you guys are going to be, I wouldn't say you guys, but they may be coming to Michigan. I'm not certain.
Right. So I'm just finding out anecdotally, people don't put it out in the press, who's coming into our state from other countries. They're really trying to keep it on the down low. I will just go back to the point that we have to be vigilant. I can't make any decisions at the executive level of the federal government. Sometimes I wish I had a magic wand. But I think bottom line, we have to stay vigilant. We have to seek out from our reporters and media to come out with the facts that are going on and do what we can to get this information as healthy citizens as well. And especially what's in our community. It's really easy to say all of them out there, right? It's another thing to say what's happening in my family, in my neighborhood, in my community, and stay aware of what's going on in your community. And if everybody did that, I think we would be in good shape and just make sure we're not doing an us versus them scenario.
616-395-1450. Peg has to follow up on something.
To your point, and the gentleman's call, we've heard a number of people calling saying that, illegal immigrants are coming into our state or being placed in our state in large groups specifically to spread the infection. CBS just reported this morning that the Biden administration is using a Trump administration policy to, when they catch these folks, to not just turn them back over the border, they're putting them back into their home countries or deep into Mexico versus right at the border where they come back over again, which has been an issue with the Biden administration since he took office.
I really have no comment about that because, like I said, I just try to see what's happening in my neighborhood, my community, my state, just doing my best to stay on top of that. And so I don't know that.
616-395-1450. Mary, I do want to get your reaction. Late last month, when Governor Gretchen Whitmer met with members of the Detroit Free Press editorial board, she really leveled some charges against the legislature, saying that her hands are tied over doing additional work now, trying to address the COVID-19 health concerns, saying because of the Supreme Court ruling and of the Unlock Michigan petition initiative that got cleared the legislature, it's like she can't do anything about what's going on now, that the legislature have not been willing partners in this whole thing. Basically, she threw the legislature under the bus. That's the initial thought I got. I'm not certain whether or not you saw the comments or whether or not it struck you the same way.
Number one, when we first came out with this virus and the lockdown, we didn't know what was going on. We just knew that a lot of people were dying. And as we worked through, our legislature was poised to respond and work together with the governor, always have been. We've worked with previous governors. It was a hyper-partisan environment too, with the presidential election, very hyper-partisan. The governor really worked hard to be, the vice president, and that choice. I just want to get away from all the name calling. I'm not going to do that. That's not my style. I'm not going to throw bombs. But number one, we don't live in a state that has one ruler, one decision maker. We are ready and willing. The legislature isn't this body of people who just are political hacks. There's nurses, there's police officers, there's firefighters, there's teachers, there's attorneys, there's local officials, there's a huge number, a huge variety of people. Every single person comes from a different walk of life. And I think it's really important for us in the way that our democracy is set up in Michigan and in our country. It's important to work together. I have done everything I could to make sure that my bills were set. So the governor has signed every one of my bills, and I've been very appreciative. And I told her that personally when we sat together and she signed the bill in front of me, the two bills 2 months ago. I think if we get the work done quietly behind the scenes, it is the most respectful thing we can do. I've worked hard to make sure my $30 billion budget is good to go, ready, our true safety net for our state, really addressing children and their mental health needs, our seniors, human trafficking. So we had some really important things that we worked on. I was really appreciative that the governor's office worked with the House Republicans, Democrats, to have a final bill and a negotiation. I don't know what was happening on the other side of the aisle with the Senate, not the aisle, but the other side of the Capitol with the Senate. But I know when we all get together, we're going to have a good product and no bombs necessary. And let's stay away from these hyper-partisan politics. We have a huge election coming up next year with senators, House members, the governor is up for re-election. I just wish we would all get back to our common core of love and respect and our religion and get it done and be respectful. I'll do my part. And I just ask everybody else to do their part too. And even in the Department of Health and Human Services, I was just on a call with the Children's Ombudsman. Great people caring about children. The director of child welfare, great person, behavioral health. So all the people in the department I'm working with are like, yes, we understand. We want to do the best we can. And let's just forget about all that noise and stay focused on the best things we can do for our state.
616.
Short story long, right?
Yeah. 616-395-1450. Let's get to a call. Good morning. You're on the line with State Representative Mary Whiteford.
Yeah, about suicide. What's it to prevent children and adults committing suicide because this killing disease we got? I can hang up and listen.
I appreciate the call. Thank you very much. Yeah, people taking their own lives. Unfortunately, a lot of the things that we have had in the past has been put on hold for a little while.
Yeah, so I've been so blessed to be able to have known these issues as I visited over 10,000 homes in Allegheny County, that it really was an issue with behavioral health, with broadband and connection. So, and it's all connected together, right? If we can't communicate, and if we're living in rural areas, we can't get the help that we need. And so that's all ready to go for broadband expansion. We got it all through Laketown Township because they're great squeaky wheels. But behavioral health, we have our crisis and access line that has been signed into law, is expanding across the state. So anybody can call and find out somebody nearby who can help them. We've got the CSUs, crisis stabilization units, that should be popping up all over. So people don't have to go to emergency rooms. They can get the help that they need when they need it and not languish in ERs or end up in jail because police officers don't know, there's nowhere else for them to go. So just getting these things going, I really want to use a lot of the federal COVID money, a chunk, out of 5 billion altogether. I'm hoping to get a priority, which passed the House, on psych beds across the state, for crisis units across the state, for just real generational changes and opportunities that we can do to help our, my great grandkids, but to help people as soon as possible. And it has to get built up. So just, I met with some parents whose son was in an ER for 3 weeks waiting for a psych bed. And that father looked at us and said, this system is killing our children. And it's true. And I said, I'm so sorry it's not ready now, but we have all these things working through and getting developed that has already been started. We're snowballing it. So I just, and with a state with almost or over 10 million people, it takes time, but things are going in the right direction. We're not stagnant. We're looking to the future. And that's where Governor Whitmer has been very supportive. She signed each one of those bills, seeing that we have to have foresight and plan for the future and not just sit there and say, oh, well, I'm gonna do this. It's gonna be all better. And it's not. But it's big foundational changes that are in the process.
Mary, I want to touch base with you on a statement from your office earlier last month about a new law that will expand access to health care and reduce costs for patients. Tell us a little bit about this bill.
Yeah, so if anybody's heard about the community mental health system, it's a public system for people on Medicaid, but it's also a safety net. And it's written into the mental health code. It's been around for about 30 years. So what it is, you've got your commissioners at the county level who set up the board. You have to have a certain number of people who are part of the system or a family of the system. And it's like somebody like my Uncle Al. He's 70 years old. He's been disabled developmentally since he was born, and he's never going to be able to take care of himself. So he's been part of the system in the state he lives in. But it includes all of our public money for autism, as well as drug addiction, substance use disorder. What I found is that there's layer upon layer of paperwork and administration. And all I hear over and over again is that we don't have enough money to pay to take care of people at the local level. And so I've reformed it. I studied all over the nation, different systems that they do it. And I found out really the best way to do it is to remove barriers and have funding go directly through, potentially freeing up $300 million of money that's currently in administration. And we can provide services to everybody and provide services to mild to moderate illness versus just severe. And like in Allegan, we're setting up, it's an old Shopco grocery store, to be a one-stop shop for anybody to come in and get the services that they need. And so that's what this package is about. I've had 2 hearings so far. I've had people say, oh, you're privatizing it. You're trying to do it so somebody else is making money. And it's not that at all. And so I'm just traveling around the state, just dispelling myths, getting input. How can we make it better? Because it's a major rewrite. There's another plan in the Senate right now, which has stark differences, where health plans would be managing that money or managing those cases. And I really think neighbors taking care of neighbors is the best way to do it. And when I knocked on doors, like I said, in my county, and I travel around, everybody who works for my community mental health, they live in the community and care about their neighbors. And so I'm really trying to fortify that, give them more funds to be able to do the things they need to do to help people be safe at home, and go out and keep people from going, to the emergency room or to jail. 20% of people in prison are developmentally disabled. Over half of people in jail are having some kind of substance use disorder or mental illness. So I think it's a really important thing to be able to reform the system, reprioritize, focus on what really matters, and that's people and people having their own best life. So that's
State,
basically
state,
it.
State Representative Mary Whiteford. If you need to get a hold of her, her office number 517-373-0836, 517-373-0836. Mary, as always, we appreciate the time. Thank you very much for joining us this morning, and let's do this all again in about 4 weeks.
Thank you, Gary. Thanks, everybody. Have a wonderful day.
Thank you very much, Mary Whiteford on 99.7 and 1450 WHTC.